Hello all, and welcome to our July Atlas Provider Roundtable. We are very excited to have you with us today. In terms of our agenda for today's roundtable, we'll be starting with an update on Atlas website traffic. We'll be sharing key dates for data collection. We'll be looking at the current treatment facility survey participation rates, as well as giving you a glimpse of the new password protected portals look, a bit about patient experience survey support, and then we will turn it over to Q&A. And just as a note that in the appendix, we have recommendations for how to complete the treatment facility survey. So starting off, an update on Atlas website traffic. We've had over 110,000 website sessions since launch, and you'll see here the breakdown by state. So you'll notice that New York has had 28,000 sessions, North Carolina over 16,000, Massachusetts over 8,000, Louisiana almost 7,000, West Virginia 6,000, and Delaware about 2,500. As a reminder, as you've probably already heard from us in several emails, now is your chance to respond to the treatment facility survey. You should have already received a link for the survey. The deadline to submit is July 30th. So coming up in just about 2.5 weeks. As a note, you must complete and attest your responses online. We will not be accepting paper or PDF surveys. And so you should have received a reference copy of the survey. This is not where you submit your responses. That's instead to help you prepare to complete the survey. As a reminder, again, out-of-date information will be retired from the website this November. So if you do not submit the 2021 survey, even if you submitted last year, your website profile will be incomplete. And as a note, all facility profiles are already live on the Atlas website, so you can go and see your facility profile now. As I said, key tips are included in the appendix, and if you have any questions or need any help, please submit a ticket at the Atlas Help Desk. Our current survey response rates across the 4 states where we're currently collecting data. We have 3 responses in Delaware, 50 in Massachusetts, 148 in New York, and 41 in West Virginia. You can see the percent of facilities that have responded. And with a deeper dive into the regional response rates, I will now turn it over to my colleagues Leah and Angad.
Thanks, Carolyn, and good afternoon, everyone. So as you can see here in Delaware, in Newcastle County, we're at 6%. Kent County, we're still waiting on some surveys to come in, and in Sussex County, we're at 6% as well. In Delaware, we've been conducting outreach sort of on a few different levels. First, we have been outreaching to providers and facilities directly with links to their surveys. We've also been calling providers as well to help answer any questions that folks might have. We're also willing to schedule time over Zoom to walk folks through survey completion also. In Delaware, historically, we've seen pretty good traffic. As folks might know, we are linked to Help Is Here DE as well. So looking forward to continuing to work with providers to increase survey rates in Delaware. Next slide. So in Massachusetts, you can see here where we are with the regional response rates. In Massachusetts, we've worked very closely with regional managers. We've conducted Atlas webinars to walk folks through how Atlas works, to answer questions on the survey as well. BSAS has also been a wonderful partner and has sent out email communication to providers encouraging participation also. And so again, these percentages are sort of increasing as we speak. So we're looking forward to sort of continuing to see surveys come in from Massachusetts. And then here in West Virginia, again, percentages are increasing every day. We work very closely with our partners at the Department of Health and Human Resources. They've been sending out outreach to providers, in addition to some outreach that we've been doing, again, sending links so folks have the survey handy. We've also worked with the Department of Health and Human Resources to release a press release, again, encouraging participation. So we're, again, looking forward to seeing additional surveys come in as well. And now I'll turn it over to my colleague, Leah Kaufman.
Hi, everyone. Thank you so much for joining. So looking at New York survey participation, we're right around 20%, as Carolyn shared. Obviously trying to work to get those rates up across the state. Everyone's looking pretty consistent, actually. The Northeast is a little bit lower. I wanted to emphasize, the importance of getting that survey in by the end of this month, because there won't be an opportunity to update your information until next year if you miss that survey window. And also wanted to touch on a couple of frequently asked questions we've been hearing from folks in New York. So one of the big ones is around when you have multiple levels of care at a facility, do you have to do separate surveys for those? I just wanted to reemphasize that all of the Atlas is done at the physical address level. So if you have multiple levels of care, it's still one survey for that address. And you'll see that it will let you answer certain questions by level of care if you need to do so. Another question we've been getting is, what do you do if there is a closed facility or if you have a new facility? And you can go ahead and reach out to me directly or our atlas@shatterproof.org email, and we'll make sure that we get that updated. Likewise, if you receive an email from us with a survey in it, or if you don't receive one, we're happy to change contact names for your surveys. So if you can't find an email that had the survey link in it, please feel free to reach out to me. My email's on the slide. And also if there is a change of contact for a specific facility, we can change that and resend you the link. Otherwise, we hope that you can get the survey in the next couple of weeks. The deadline is July 30th. And I think with that, we can move on to the next slide.
Wonderful. Thank you, Leah. And thank you for the reiteration. Exactly. If you ever need a contact change, a link resent, you can contact us either at the Atlas Help Desk or at our specific emails or at atlas@shatterproof. There's no wrong way to contact us. We will respond to your message. So in terms of why submit the survey, I want to talk a little bit about the updated password protected portals. So as you'll remember, facilities that submit the survey have access to these portals, which have detailed information not only about your facility, but also how your facility measures up to facilities across the states in which you are in. And you can also use it to find quality improvement resources for treatment providers. So this is a brief snapshot. And if you allow me to, I will show you what this looks like on the web. Thank you for your patience. And so you'll see here a facility profile. And as you'll note, I am not including the name at the top. I don't want to expose who the specific facility is. But you'll notice that in this view, you have the opportunity to select the specific facility that you're using. You'll no longer need to go to different portals for different facilities. You can see how your facilities stack up against the state in terms of patient survey ratings. And you can compare how your facilities perform against the state overall, as well as access those quality improvement resources and view dynamic data. So we are very excited about this offering. We think that this is really a great opportunity to access more information. And so remember, that is only accessible to those who have submitted data. Also, we would love your feedback. If this looks of interest to you, please email us at atlas@shatterproof.org. We would be happy to take the time to walk through the portal with you and get your feedback. We want to make sure that these portals are as useful as possible.
And Carolyn, how do they access these portals if they haven't done so in the past?
Great question, Leah. So right now, this new look is not yet live, but if you submitted data in 2019 or 2020, you should have received a login to your portal. In this case, you go to treatmentatlas.org, and I can pull that up on my screen and click on the Professionals tab. So if I show you here, oh yeah, go for it, Leah.
So each facility only has one person that has access to the professional portals?
Correct. So one main person got access to your professional portals, and then that person can delegate up to 5 additional contacts who can also have access.
Okay, and in some cases, I think we've heard from folks who were listed on the professional portal last year, but might have left the organization. So they just need to reach out to Atlas to change that contact person.
Yes, exactly.
Okay.
Thank you for that question.
Yeah, and I will say our participation, or I guess the number of providers logging into those portals has been very low. You know, obviously, I think we're attributing a big part of that to COVID. If you saw the dashboards before, they weren't terribly interactive. And so this one that Carolyn is going to show you is a lot more useful than last year. So definitely try and log in.
Exactly. Thank you for that point, Leah. That's exactly very true. We're very excited that this new portal is much more dynamic. So I won't be able to show you too much more just because we want to preserve the identity of this partner by not showing too much of their portal screen. Again, you'll notice that you can select about facility info, details, see the patient surveys, and you can see a detailed count of how many providers offer, for instance, meet certain principles of care. The data will change dynamically. And you can see more detailed information about which specific principles of care are being met and which are not. And I want to just reiterate that in addition to these updated portals for providers, our payer and state partners will be able to view these portals. And so they will also get a sense of not only where facilities are really excelling at providing high quality care, but also where there's room for growth. And I'll note that coming very soon, we will be launching a patient experience survey toolkit. And so for those of you who have really wanted to get patient feedback, you'll be able to access this toolkit. It will include a promotional flyer, a QR code, and link for you to use in your own communication materials, and tips on how to encourage patient responses at your facility. In addition, patients can now search for individual facilities on Atlas to submit feedback. So we're very excited about this enhancement to the website. You no longer need to search just by location. A patient can go in and type the name of your facility to find you. Just a reminder on our timeline. As you see here, right now we're in the midst of data collection, which will run from now until July 30th. Between August and October, we will be analyzing the data on our end. We will also open the provider preview period. So that will be a 2-week period approximately in which you'll have a chance to review how your data will be displayed on the Atlas website and to let us know if there are any data transfer errors. So if you wrote one thing in the survey, but it didn't transfer correctly to your profile. And then in November of this year, we will be updating all the profiles for providers in Delaware, Massachusetts, New York, and West Virginia. And as a reminder, at this time, if you haven't submitted a survey, even if you did submit last year, your profile will be incomplete this November. So just a final reminder, submit this year's survey. The deadline is Friday, July 30th, again, just over 2 weeks from now. And by submitting your data, you ensure that your profile will be complete, as I discussed. Your facility will automatically be included in relevant searches. So right now, we filter out facilities that have not submitted the survey. Your information will help tens of thousands of visitors to Treatment Atlas find the appropriate treatment for them. And you'll have access for free promotional materials, I apologize. Again, if the primary contact for your facility has not received a link to the survey, please contact us at the Atlas Help Desk or at atlas@shatterproof.org. And I will also note, I apologize for a bit of a funky screenshot, we recently recorded a video of reasons to submit the Atlas survey in the words of providers themselves. So we have 2 fellow providers, Hannah von Regenmorter from Eleanor Health and Lisa Blanchard of Spectrum Health Systems, discuss why they chose to submit the survey for their facilities. So for those of you who aren't sure that you want to submit, we encourage you to watch the video. And as a last note, for those of you who've submitted but just are tuning in for any updates, we would love if you could help spread the word. We'll certainly be sending out the video now with Hannah and Lisa. We encourage you to share our blurbs via social media such as LinkedIn, Twitter. As a final note, if you have any questions, you can check out treatmentatlas.org to learn more about Atlas. Anything survey related, you can contact the Atlas Help Desk. And then for state-specific questions, you'll see our email addresses below. And with that, I will stop the share and turn it over to questions.